Catholic Charities is taking this trauma-informed approach because it's something we really have to do if we're going to be as effective as we can be in providing all of our services to the people who come to us for help. So that 20 years of research that I mentioned, part of that was to recognize that everybody that comes to us, whether they're coming here because they're homeless, they're coming here because of child abuse, or because they have serious mental health issues, that we just know now that trauma is going to be in their background. And so we as an organization have to understand that and have to understand what things we need to change so that we can be as helpful as we can be. There's a catchphrase in doing trauma-informed work that goes something like, it's not about asking someone what's wrong with you, but about what happened to you. So I think if everyone can watch this workshop and have some appreciation for the effects of adversity and trauma on the folks that come to us for help and on our coworkers, that it creates a better understanding of the behavior, the emotions that go along with that, and that it isn't about thinking of someone as being sick or ill or bad or blaming them, but just trying to have some understanding that those things arise from people going through some really bad experiences.
This is the Trauma and Trauma-Informed Care Workshop. So a lot of the government agencies that fund us have transitioned to trauma-informed systems. The Division of Mental Health and Addiction Services, and that is a federal agency, has published guidelines and standards for trauma-informed care. And the New Jersey Division of Mental Health and Addiction Services and the Department of Children and Families are all moving forward with their trauma-informed care. And they expect and require that service providers will also become trauma-informed. So the ACE study was the Adverse Childhood Experience Study, and it's an ongoing study between the Centers for Disease Control and Prevention in Atlanta and Kaiser Permanente in San Diego, California. This is one of the largest investigations ever conducted to assess the associations between childhood maltreatment and later life health and well-being. ACE findings suggest that certain experiences are major risk factors for the leading causes of illness and death, as well as poor quality of life in the United States. The impact of adverse childhood experiences over the lifespan is tremendous. Maltreatment in childhood can result in impairment of the brain and physiological development, changes in the brain neurobiology, social, emotional, and cognitive impairments, and adoption of health risk behaviors as coping mechanisms such as eating disorders, smoking, substance abuse, self-harm, sexual promiscuity, violence. Early experiences help to determine brain structure, thus shaping the way that people learn, think, and behave for the rest of their lives. What is trauma? There are a number of definitions, but the one that I think is one of the best was published by SAMHSA in 2012, and it includes 3 key elements. Individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as overwhelming or life-changing, and that has profound effects on the individual's psychological development or well-being, often involving a physiological, social, and/or spiritual impact. The experience of violence and victimization includes sexual abuse, physical abuse, severe neglect, loss, domestic violence, and/or the witnessing of violence, terrorism, or disasters. We can break trauma down into 2 categories. One is acute trauma, which typically involves a one-time experience, such as a disaster or a car accident, or complex trauma, which usually involves prolonged or multiple traumatic events. Complex trauma typically occurs within a caregiving relationship by neglect, physical, sexual, or verbal abuse, and for a child will disrupt their feelings of attachment to others. So trauma is individualized. It is not the objective facts of an event that determine whether the event is traumatic. It's the way in which each individual internalizes the emotional experience of the event. Traumatic events or circumstances often have lasting adverse effects on an individual's basic sense of self, trust in others, physical, social, emotional, or spiritual well-being. Trauma is disabling. It can impact feelings, becoming emotionally overwhelmed, fearful, anxious, helpless, or quick to lash out and become defensive. It can impact thinking. People can't think clearly when stressed. They have trouble managing their anxiety or their distress. And it can impact functioning. The capacity to function every day in everyday life is impaired. Some consequences of trauma include over-control, self-blame, passivity, expecting and eliciting negative reactions from others, addictive behavior, self-harm, impaired attachments, and interpersonal skill deficits. Trauma can be overlooked because it mimics a lot of other conditions. A lot of the behavioral responses will resemble common disruptive behaviors and are often under-identified as trauma symptoms. An example of that is children who are diagnosed with attention deficit disorder sometimes actually have a trauma. Stress modification is different by ages, stages, and expression, and we often don't connect the symptoms and behaviors to trauma, and thus it leads to punishment instead of help. Therefore, we need to presume the clients we serve have a history of traumatic stress. Being trauma-informed also means that we recognize the effects of trauma and adverse experiences in our own lives and in our coworkers. When an organization takes the steps to become trauma-informed, every part of the organization, management, administration, and support and service delivery is assessed and potentially modified to include a basic understanding of how trauma impacts the life of all the individuals in the organization. In a trauma-informed system, trauma is viewed not as a single discrete event, but rather as a defining and organizing experience that forms the core of an individual's identity. Sometimes what we do actually re-victimizes, so any interaction or personal encounter that recreates aspects of previous traumatic experiences or that uses power to punish is harmful to the individual involved. So what is trauma-informed care? It's building trusting relationships with the individuals we help and with our coworkers, telling people what you're going to do before you do it, seeing trauma responses as adaptations rather than manipulations, and teaching and supporting the person to learn ways to manage emotions. How would people be treated in a trauma-informed environment? We would see them recognizing that the function of behavior, even rage, repetition compulsion, and self-injury is adaptive. So people develop behaviors in a way that helps them to survive, even though they may seem maladaptive to the person viewing it. The individual is the center of treatment in a trauma-informed environment. Power and control is minimized. Constant attention to practices. Language is person first. So we don't talk about victims, but someone who was victimized. And it involves training of all staff to improve knowledge and sensitivity to trauma-informed issues. What is resilience? Resilience is remaining stable with healthy levels of psychological and physical functioning in the face of disruption or chaos. The ability to adapt to stress, adversity, trauma, or tragedy. And resilience can be learned. It's not necessarily an inborn trait. How to become more resilient. There are certain behaviors and things that we can practice that help us to become more resilient. So we can practice overcoming hurdles in everyday life, having a purpose or finding a purpose, accept reality with a positive attitude, learn how to improvise, meditate, so any mindfulness training, exercise, developing an abiding sense of humor, building strong support networks. Keep your mind flexible, face your fears, reframe, so we can reframe negative things in a more positive way, nurture a strong sense of self, know when to be kind to yourself, and be compassionate. What are some of the values of trauma-informed care? They include dignity and respect for a person, not blaming, So what happened to you rather than what's wrong with you. A holistic approach. The person is seen as the totality, not just of their behaviors of the moment. And learning and support for self-care and wellness. So kindness goes a long way. Everyone you meet is fighting a battle you know nothing about. So be kind, always. Vicarious trauma. Trauma-related stress reactions and symptoms resulting from exposure to another individual's traumatic experience can cause vicarious trauma. The demands of caregiving exact a price from behavioral health professionals that cannot be ignored. Protective factors include training on trauma-informed care, emotional support from colleagues, and good self-care. So some self-care things include sleeping at least 8 hours a night, eating nutritious foods, exercise, practicing good boundaries, and using positive coping mechanisms versus negative coping mechanisms. Understanding trauma is imperative because trauma is pervasive. Trauma's impact is broad and diverse. Trauma's impact is deep and life-shaping. Trauma, especially interpersonal violence, is often self-perpetuating. Trauma affects how people approach services, and the service system has been re-traumatizing in many cases. Healing is possible. So in summary, a lot of the funding sources that we have, the Division of Mental Health and Addiction Services, the Division of Children and Families, and our own agency are all changing to trauma-informed systems of care. Trauma impacts people over their lifespan. Trauma is individualized and results from an event that is experienced and has profound effects on that individual. Trauma impacts how we think, how we feel, and how we behave. Trauma's impact may look different with different people, and trauma is so common that we need to presume that everyone we interact with may have a history of trauma. We want all staff to be able to approach people with the same language and the same understanding of trauma. Any interaction that recreates aspects of trauma is harmful, and we want to be careful not to re-traumatize anyone. Trauma-informed care includes building trust, telling others what we are doing before we do it, and supporting others in managing their emotions. Trauma-informed care environments include safety, they're welcoming and comfortable, power and control is minimized, and there's a collaboration between staff and those we serve. We will be saying things like, what can I do to help? What do you need? What happened to you? Instead of what's wrong with you. Staff should be even-tempered, have a calm approach, and compassionate concern. The benefits of this will include increased safety, increased quality of care, increased work satisfaction, increased organizational wellness, and reduced negative interactions. And this is a website to find out more about trauma-informed care.